Our brain is a very important part of us. It helps us make decisions that keep us strong, healthy, and happy. When we do things that are healthy for our body and mind, the brain makes a chemical called dopamine. Dopamine makes our brain feel good, and that makes us feel good. That's why when we eat healthy food, we feel good. That's why when we do exercise, we feel good. And that's why when we learn something new, we feel good. Dopamine rewards the brain for making healthy and smart choices. Choices that help us feel good and survive. But there are also unhealthy things we can do that feed dopamine in the brain. Smoking cigarettes is one of them. When you smoke a cigarette, the brain makes a lot more dopamine, more than it needs. This can make you feel real good for a short time. It may even help you concentrate, give you more energy, and make you feel happy. But if you smoke cigarettes for a long time, the brain starts to think it needs even more dopamine to make you feel good. This means you want to keep smoking, and only another cigarette will make you feel better. This is how you get addicted to cigarettes. And cigarettes can make you sick, real sick. They can even kill you.
Hi, welcome to our presentation about addiction. We are going to give you some useful information about this disorder, and then we're going to present some videos. Addiction is a compulsive disorder in which a person must engage in activity or ingest a substance despite its negative impact. The DSM-5 says that the substance use disorders has a diagnosed criteria. It established 9 types of substance-related disorders: alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedatives, stimulants, and also tobacco. Some of the signs and symptoms we will find in our patients or in people with these disorders will be impulsiveness, loss of relationships or job due to the focus on the object of addiction. Also impairment, overdose, withdrawal from the substance too, poor appetite, poor self-care, social isolation. And then some of the physiological symptoms would be edema, fatigue, shortness of breath, also damage to major organs. The signs and symptoms of withdrawal vary by the substance that the patient is addicted to, and it may require medical attention. The assessment is done by the professional, and it includes screening, brief intervention, and referral to treatment. This addresses the growing public health problem. There are three main parts. The screening is performed using a standardized tool by the RN or any other healthcare worker in a setting. The second one is a brief intervention, and it consists of the RN or the healthcare provider providing the patient with the education about the health risks involved in substance abuse. And the third one, the nurse or the healthcare professional makes a referral to treatment with specially trained professionals for the patients who test positive during the screening process. The pathophysiology. Dopamine is a neurotransmitter responsible for pleasure and rewards. Drugs such as opioids increase the availability of dopamine at the synapse, producing positive reinforcement for drug use. Alcohol and sedatives depress the central nervous system and alter the mental status by enhancing the effects of GABA, the major inhibitory neurotransmitter in the central nervous system. Some of the interventions are promote sleep and safety, encourage health eating since the patient might not be eating as well, support the patient to improve the hygiene, establish a therapeutic communication and relationship, identify and help in developing healthy coping skills, help the patient set goals, provide basic level assessment, and then make referrals to a professional trained in substance abuse treatment. Some of the pharmacological interventions are disulfiram for alcohol maintenance, carbamazepine for alcohol withdrawal, methadone for opioid, naltrexone for detox, and Chantix, or Ibupro, or bupropion for nicotine withdrawal. Some potential diagnoses of nursing are risk for suicide, risk for injury, disturbing sleep pattern, nutrition less or more than body requirements, and self-neglect.
Your 4-year-old, you were on drugs when she was born.
No, I was on methadone, prescribed.
And your 2-year-old.
She prescribed methadone.
And were the babies born healthy?
Yeah, they were born healthy, but they had to go through withdrawal.
Caitlin's 2 children were addicted to drugs when they were born.
In the past, all 3 of my pregnancies have been planned because I love kids, first of all. At the time of getting pregnant, I thought that it would definitely motivate me of getting clean.
7 months ago, my husband and I gained custody of her 2 children. DHS found the children alone in the hotel room and immediately called me. The oldest daughter has a lot of temper tantrums. They can last anywhere between a half hour to an hour and a half of constant screaming and kicking. I quit my job to take care of the girls full time, but as of right now, I'm very emotionally, physically, and financially strained. Caitlin is pregnant now, and if the baby is born addicted to drugs, it will probably go into foster care because there's no way I can take care of this 3rd child.
In God we must.
Sir, please get out of the vehicle.
You have a great night.
Sir?
Huh?
Please get out of the vehicle.
Get out of it. You know what? Absolutely. And thank you for doing your job. I appreciate it. Also, thank you for releasing me upon my own recognizance.
Sir, have you been drinking?
Yes, I have. I've had 5 or 6 small batch bourbons.
That's a lot. I'm going to have to ask you to take a breathalyzer test.
Mm-hmm.
Got a runner! Stop running!
Try to catch me! Ranger Rick, stop! Oh, yeah. Okay. Oh, yeah. Oh, woo! Yeah! Look what I'm doing! Look what I'm doing! I handled this perfectly! This car is so powerful! Oh, yeah! Oh, wait, this is not my car! This is not my car! I don't have a gun in my car! Yeah! Take the car back. Okay, play it cool. Play it cool. He's not gonna notice. He's not gonna notice. Control my breathing. I gotta control my breathing. Oh no! He's slow.
Stop the vehicle!
Officer,
now!
are you in need of assistance? I'm back
Stop
up.
the vehicle!
I'm back up.
Stop the vehicle now!
I see you.
Stop the
No, I
vehicle!
see you.
Get out of the vehicle!
Hey, here's the good news. I came back. Let's just talk about this. Oh, hey!
Right now, I am withdrawing from opiates, and it's really hard because my condition is so painful. I've been on fentanyl patches for the past year at a relatively high dose, and coming off of that was horrible. So I started on Suboxone, and it took me a while to taper from that. And then when I got to the hospital this time around, they had to give me, anesthesia and pain meds from my surgery, and they put me on all this Dilaudid every 8 minutes, and then they're just pulling me off of it.
Two things no mother wants to hear from her doctor while giving birth: tequila and happy hour. But one Valley woman heard both, and that's why she's suing a local hospital, claiming the doctor was drinking before delivering her baby, who suffered injuries that will last a lifetime. Contact 13 Chief Investigator Darcy Spears has a heartbreaking story caught on camera.
There weren't that many people in the bar when I left.
I'm sorry, did you waste your drink?
That's Dr. Frank DeLee openly talking about drinking while Alex Sims was in induced labor and facing a possible C-section here at Sunrise Hospital in May of 2015. Alex's regular doctor was on vacation, and DeLee was the hospital's on-call OBGYN.
So, is Belvedere that you had to pour out? Is that what you're
No, tequila.
As if talking about booze isn't odd enough, check out what the doctor does next.
Turned out to be the doctor who was barefooted in his Bermuda shorts. And
Wait, the doctor was barefoot while delivering a baby?
Yes.
Attorney Cal Potter represents Alex. He says the system betrayed the entire Sims family.
It's a very disturbing sequence of events that took place.
I kept telling the doctor, like, I can feel everything. I think the epidural wore off. And he's like, oh, just scoot your fat ass down. Oh, I bet you wish your doctor would have came back in town.
It sounds too bad to be true, but on the video...
I was told not to say lift your fat ass up. Don't you wish Richter stayed in town this weekend now?
It was just jaw-dropping. Like, I just couldn't fathom why all this was going on.
Marie says once her grandson Jared was delivered, her heart sank.
Because the baby arm looked like this, and I said, something's wrong with his arm. What's wrong with his arm?
Drive your truck. According to the lawsuit, Dr. DeLee's rough delivery of Jared caused Erb's palsy, paralysis to the arm due to nerve damage.
I think any person should be horrified.
Attorney Potter named the hospital and nurses in the lawsuit too, saying they had a duty to stop Dr. DeLee. Medical experts hired to review the video determined DeLee used inappropriate techniques by pulling Jared's arms, and the doctor failed to diagnose and recognize the pressure of shoulder dystocia. In court documents, Dr. DeLee denies any liability. Sunrise Hospital has asked the court to toss out some of the claims.
Cage Aid is a 4-question screening tool used by nurses and practitioners in the clinical setting to screen patients for possible substance abuse disorders. Hi Josh, I'm Lindsay. I'm a nurse at the clinic, and if it's all right with you, I'd like to ask you a couple questions.
Sure.
And if you could answer as honestly as possible, that would be great, okay?
I'm a pretty honest person.
Okay. Have you ever felt like you should cut down on any of your drinking or alcohol use?
No.
Okay. Have people annoyed you by criticizing you about your drinking or drug use?
Often.
Have you ever felt guilty or bad about your alcohol or drug use?
No, I don't see it as a problem.
Okay. And have you ever had to have a drink or used any of the drugs first thing in the morning to take the edge off or steady your nerves?
Pretty often.
Pretty often? Okay, thank you.
You're welcome.
Josh's results of 2 positive answers is clinically significant and indicate a need for referral to a specialist. The normal cutoff for the cage is 2 positive answers. However, the consensus panel recommends that the primary care clinicians lower the threshold to 1 positive answer to cast a wider net and identify more patients who may have substance abuse disorders. A number of other screening tools are available.
Hello again, my name is Josh. This is Lindsay. I'm going to be conducting an interview today about using the drug abuse screening test, or the DAST-10 test. Alright, Lindsay, how are you doing this afternoon?
Great.
Wonderful. The following questions concern information about your possible involvement with drugs, not including alcoholic beverages, during the last 12 months. Okay?
Not including alcohol?
Not including alcohol. Okay. Alright, please answer every question. If you have difficulty with any statement, then choose a response that is most correct. Okay? Alright, so in the last 12 months, have you used drugs other than those required for medical reasons?
Yes.
Yes. Do you abuse more than one drug at a time?
No.
Are you unable to stop abusing drugs when you want to?
Yeah, I think so.
Have you ever had blackouts, flashbacks? as a result of your drug use?
No.
That you're aware of?
Not that I'm aware of.
Has
No.
anybody ever woken you up after a blackout? Not know where you were?
No.
No?
No.
Okay.
I know where I am usually.
Do you ever feel bad or guilty about your drug use?
Yeah, sometimes.
Sometimes.
Mm-hmm.
Does your spouse or parents ever complain about your involvement with drugs?
No, they don't know about it.
They don't know?
No.
Okay. What about your close family, friends?
No, they do them with me, so.
Okay. All right. Have you engaged in illegal activities in order to obtain drugs?
Maybe.
Maybe.
A little bit.
I won't call
yeah.
the cops. You're fine.
Yeah.
Okay. Have you neglected your family because of your use of drugs?
No, I don't think so.
Have you ever witnessed, or excuse me, have you ever experienced withdrawal symptoms? Ever felt sick, coming down with like the flu when you stopped taking your drugs?
No.
If you've been off of them
No.
for a certain period of time?
Alcohol, yeah, but no, this isn't about that. So.
Okay. Have you ever have you had medical problems as a result of your drug use, such as like memory loss, hepatitis, convulsions, bleeding?
I had a stomach problem at one point from the pills I was taking
Okay.
too much, so yeah, I guess you would say yes.
Were you upset stomach? Did you notice any like bleeding?
No,
or
I had
anything
almost like an
that?
ulcer. Yeah, no, I went to the
Okay, so-
doctor for it,
yeah.
but they didn't know why per
Why?
se.
Gotcha. But you had an idea of why you had the ulcer?
Mm-hmm.
Gotcha. All right. Thank you for your time.
Thank you.
You're going to just keep on recording?
Mm-hmm. So now you have to explain the scoring.
Okay. All right. So how scoring works, she will score 1 point for each question answered yes, except for question 3, which a no receives 1 point. Question 3 was, are you unable to stop abusing drugs when you want to? Which she said no. So there's a point. So anyways, so she has a grand total of 1, 2, 3, 4, 5 responses to yes. So with a degree, with a number of 5, that results her in receiving a moderate level degree of problems related to drug use, drug abuse. Suggested action would be a further investigation. So we would use another screening tool and try to get down into her history quite a bit more to see where we're at with this drug problem that Lindsay has. One, two, three.
The cage aid is a four question
Or question
screening tool.
Screening tool.
Okay. We're probably gonna need to redo that.